Top stories from around the island. To the point. Without the fluff. Puerto Rico headline news. Please subscribe and don't forget to hit the bell notification.
Hello and welcome to Puerto Rico Headline News for April 15th, 2020. This is your COVID-19 update for Puerto Rico. Along with discussing the latest figures provided by the Department of Health, there's a few things that I want to mention. One of them being there's protests that are starting to break out on the island. A lot of it has to do with the lack of testing. Many are realizing the necessity of testing, and they're beginning to not trust the numbers that are being provided by the government. These numbers that have led the government to take action as far as the lockdown and other restrictions. Now the population feels like these numbers are not making sense, and they don't quite understand why we're behind in testing when compared to many other countries around the world. There's also a case that's being investigated now, and that's the corruption in the purchase of rapid tests within the Department of Health and the Emergency Management Administration. So that's coming. A lot of that is coming out to light. People are seeking immunity and providing information on what's been taking place behind the scenes and what happened in this latest scandal. So we'll have some additional news on that tomorrow, when one of the high-ranking officials is set to either accept or deny immunity in order to go ahead and let the cat out of the bag, so to say. So let's go ahead and get into this article here. Again, if this is your first time here, please don't forget to subscribe. Very important to hit that notification bell. This way you'll be notified whenever I do release a new video. Like the video as well. Makes it a lot easier for others who may be interested in the same information to be able to find these videos. And also, don't be afraid to share the content. So let's go ahead and get into this article. This is for April 15th, Wednesday, from El Nuevo Dia. And basically, let's mention here how the amount of deaths has increased to 51. Yesterday, there was no reported deaths. Today, it's increased to 51. So let's go ahead and get into this article, and it reads, after a day without deaths that were reported because of the coronavirus, the total number of deaths associated with the disease increased to 51 today, this Wednesday, 6 more than those reported yesterday. So this is what the health department confirmed. Meanwhile, confirmed cases of the virus increased to 974, representing an increase of 51 over yesterday. Now, the 6 new deaths that were reported are 4 people who tested positive for the virus and 2 who, at the time of death, had clinical symptoms consistent with the disease, so they were determined to have died because of the coronavirus or COVID-19 without being tested. Article continues to say one of the women was 74 years old and the other was 93, from the Metropolitan and Ponce region, respectively. Now, the death of 2 men was also reported. One who was 88 years old and another man, 45 years of age. They were also from the Metro and Ponce region as well. This was reported by the Department of Health. The article continues to say, meanwhile, out of the 51 new confirmed cases, 8 were processed in the Department of Health laboratory, just 8, and 43 from private laboratories around the island. Meanwhile, the Veterans Hospital actually did not report any new cases. Of the total confirmed cases, 466 are women and 508 are men. So far, 9,209 tests have been conducted, out of which 6,825 were negative and 1,404 are still pending. The results haven't come back yet. Now, the municipality with the highest number of reported cases is still San Juan with 131, followed by Guaynabo with 52 and Bayamon with 48. And still, the Department of Health has not been able to find any information on 335 confirmed cases. Meanwhile, the age group that continues to dominate the statistics is that of the 50 to 59 year age group, with 216 infected patients in that age group. So we'll quickly just cover this graph. This is just again the visual to give you an idea from March 13th until now, the amount of confirmed cases that have been reported so far. And then this one is just the general map of Puerto Rico, showing us where the higher concentrations of confirmed cases are. And as we're able to see there, the highest concentration is the metropolitan area, San Juan, Guaynabo, followed by to the west in the Mayagüez region there. As is understandable, there's been many articles that have been coming out from various newspapers and the media itself talking about the importance of testing and the lack of testing that's taking place here in Puerto Rico. So, a lot more of the population is beginning to realize the lack of testing that's being conducted here on the island. This particular article is just one of many. But basically, the question is, why is it necessary that tests be conducted in Puerto Rico? So a lot of information is being provided. People are learning a lot as they do their own research as well. And if we take a look at the numbers here in Puerto Rico, they've only tested 9,000. 9,200 tests have been conducted so far. As a result, 975 have been confirmed cases. Um, that gives us a percentage as far as the amount of population that's been tested. If only 9,200 people have been tested out of 3.1 million of the population, that boils down to 0.003% have only been tested on the island. And then if we do the breakdown of the 9,200 tests that have been conducted over a period of 38 days, that only works out to 242 tests on average that are being conducted a day. So for many people, it's very, very concerning. They're starting to realize, based on the decisions that the government is taking as far as lockdown procedures and curfews and restrictions, that there's really not much data to back up decisions that are being done. So they're starting to feel a concern for the amount of tests that are being conducted and the fact that not enough are being done. There's a video here. I'm going to cut the volume on this video here. But here, basically, you see a group of citizens, show up in front of the news station WIPR in protest of the amount of tests that are being conducted here on the island, protesting the fact that not enough are being done, and they want to know why. So they found it concerning enough to go out and risk, of course, being fined or even arrested. This is a non-essential it can be considered a non-essential reason to be out and about from your house. But these people went ahead and did it to try to bring attention to the fact that, hey, we're aware that there's not enough testing going on here on the island. And here's another article from El Nuevo Dia that came out today, Wednesday, April 15th. And essentially, yesterday it was reported. I went over an article that reported how the Department of Health had received 200,000 rapid tests, and they were beginning to distribute them. Actually, starting on Monday, they claimed to had started to distribute them to private labs on the island, hospitals, and other places. But here, As of 1:16 p.m., April 15th, we have here. So here we see the president, Juan Reshak of the Association of Clinical Labs saying, up to the moment, the government has not distributed these testing kits or the rapid tests to the clinical labs. The few labs in the community that are waiting for these tests have decided to buy them on their own um, to be able to run these tests. So they're still waiting on these tests that they were promised. And obviously now, along with the investigation that's taking place, so here we see the Health Commission is investigating this possible transaction, along with the transaction that was conducted with another small company with no prior experience with medical equipment, 313 LLC, and these rapid tests for the COVID-19. So everything's being investigated. A lot of information is coming out of how things work behind the scenes, the exorbitant prices that were paid for these rapid tests, even as high as $46 a test, when in fact they had received a quote from another company for as little as $10 per rapid test, and in fact they went ahead and opted for the higher priced rapid test, and then one that wasn't even approved by the FDA. So we have this character here, Adil Rosa, who was the one that signed off on these purchases. So she's actually seeking immunity, asked about immunity, and she's been offered it to testify uh, in hopes of finding out more information about how these transactions occurred, and she'll have an answer whether she's going to accept the immunity tomorrow, Thursday. But a lot more information is coming out. The public is becoming aware, and they're just, it's very disheartening in the middle of a pandemic that these scandals are occurring, and it's sacrificing the health of the people here in Puerto Rico when they should be focusing on helping people. So this is your information for today. Thanks for watching. This is Puerto Rico Headline News.